Good afternoon and welcome to the St. Clair County Daily COVID Briefing. I'm joined today by EMA Director Herb Simmons and Samantha Bierman from the St. Clair County Health Department. Sam, thanks for joining us.
Absolutely. So as of today, we have tested 231,720 St. Clair County residents, which is an increase of 2,137 from yesterday. We are at 24,023 positive test results, which is an increase of 214 from yesterday. And that does include both males and females from under the age of 1 up to their 100s. And today our daily county positivity rate is 10%. And we are at 207,697 negative test results. Unfortunately, we are announcing 2 additional deaths, which does bring our total for St. Clair County to 371. Both were males in their 80s who had unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 21,555. For state totals, 14,564,776 have been tested. And we are at 1,059,324 positive test results, which is an increase of 6,642 from yesterday. And for deaths, the state is reporting 18,049, which is an increase of 123 from yesterday. For St. Clair County hospitalization numbers, currently we have 98 individuals that are admitted due to COVID-related reasons, and 12 of them are on ventilators. Regionally, we have 173 patients that are admitted, and we have 17 of those are on ventilators. For our congregate living facilities that are currently or have previously been in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had changes. Cedar Ridge of Lebanon has 156 cases and 20 deaths, and that is an increase of 3 cases for that facility. Cedar Trails of Freeburg has 27 cases and 1 death, and that is an increase of 9 cases for that facility. Freeburg Care Center has 134 cases and 7 deaths, and that is an increase of 1 case and 2 deaths for that facility. And finally, Joe's Place has 10 cases and no deaths, and that is an increase of 1 case for that facility. And for those who haven't done so already, we still have the vaccine notification form available to fill out, and that is on several platforms. It's on both Facebook pages for the Health Department and EMA. It's on the county website as well as the Health Department website. And as of today, we've had over 30,000 St. Clair County residents that have filled out that form. And just to be clear, that form is not to register yourself for a date and time for the vaccine. That is simply to allow us to have your information so that when we meet the category that you would fall into, we have a way to reach out to you and send you that specific information on how to sign up and where to go and what time. And just as a reminder, next week, Monday the 18th through Friday the 22nd, there will be no testing done at the 330 West Main location in downtown Belleville, as we are preparing to have that starting vaccinations next week.
Good. And we do have testing tomorrow in Marissa.
Yes, we
at
do.
the Village Hall.
From
So
8 a.m. to 4 p.m.
That's good. So take advantage of that because it's obvious, Sam. People still need to get tested.
Oh, absolutely.
The virus is still out there.
Mm-hmm.
You can see by the zip code report today. Each of the communities are still having the spread, and so take advantage if you live down in the Marissa area at the Village Hall tomorrow from 8 to 4. We'll go into the zip code report here. 62201 goes up 11 to 503. 62203 goes up 3 to 538. 62204 goes up 1 to 348. 62205 goes up 3 to 554. 62206 goes up 8 to 1,097. 62207 goes up 7 to 511. 62208 goes up 13 to 1,345. 62220 goes up 26 to 1,650. 62221 goes up 20 to 2,307. 62223 goes up 13 to 1,438. 62225 goes up 2 to 122. 62226 goes up 30 to 2,623. 62232 goes up 10 to 774. 62239 goes up 2 to 383. 62240 goes up 2 to 124. 62243 goes up 19 to 638. 62254 goes up 6 to 682. 62257 goes up 2 to 269. 62258 goes up 9 to 863. 62260 goes up 6 to 620. 62264 goes up 4 to 290. 62269 goes up 35 to 2,708. 62282 goes up 1 to 51. 62285 goes up 3 to 452. As Sam said, our daily county positivity went up to 10 today from 7.6%. The county 7-day rolling average is at 11% today. The regional positivity went down to 9.9. Those numbers come in with the other counties around in our region. Bond County came in at 7.0, Clinton at 16.9, Madison 10.2, Monroe 7.3, Randolph 6.8%, St. Clair came in at 8%, Washington at 22%. Today we had 110 tested from yesterday under the age of 40. Sam, the governor made an announcement today that we're excited about.
Yes.
We're looking for some sites. So, got any update on that?
Yes, so as Herb said, the governor announced that the Illinois National Guard, in cooperation with St. Clair County Health Department and several other agencies from our area, will be working together on a vaccination site that we are very excited about. We are excited not only to have the help, but that allows us to move through these tiers quicker to get all of our residents of St. Clair County vaccinated.
Well, and I know just before we went on with talking to you, and I was talking to Mila over at the health department. She's got 2 phones in her ears over there. So this is, as we say every day, this is coming together real quickly. And I know Team St. Clair and everybody is excited. They want to get this vaccination done. We're getting calls every minute of the day, it seems like sometimes. But it was good news that the governor announced.
Absolutely.
The news media has been calling, wanting comments on it. But, right now, with what the health department has been working on with 330 West Main, if we can get that big site set up, we should be able to really speed the process up.
And we understand that everyone is very anxious about when they can schedule themselves for the vaccine. Please do be patient with us. We are working through all of the bugs and looking at the logistics. Obviously, this is not going to be a quick process. This is going to take some time. But the best thing you can do right now is to fill out the vaccine notification form, which does give us your information so that when we do move to the tier that you fall under, we have a way to get that information to you on how to sign up and the specific details that you'll need.
Well, and I think it's just important too, Brian. I know you've been fielding a lot of those calls, you and Randy, and helping people that want to get signed up, maybe don't have access to the computer. Why don't you explain to them how we can help out with that?
Yeah, if there's somebody that doesn't have access to a computer, they can contact our emergency management office here, and we will work through them to gather the information we need to get them signed up and make sure they're in there to receive that notification phone call when it is their time. And then they'll contact us again, and we'll work through to get them scheduled. I know one big question we've been answering a lot is people have been asking, we want it to go quicker, we want to go quicker. Well, that's dependent on the amount of vaccine we receive. We all also want it to go a lot quicker, but we're distributing the vaccine that comes to us as quickly as possible and hope that will continue to expand in the days and weeks to come, that we'll be getting more and more vaccine.
Well, and as we talked about the other day, Sam, part of what we're doing is looking around the country at some of the other states and some of the issues that they've ran into. Some of them, people were standing in line for 24 hours, 36 hours just to get up there and then to be told, well, we're out of vaccine.
Exactly.
We're trying to learn from some of those logistical nightmares that other states are having. because we don't want people sitting in line for
No.
that length of time.
We want the process that we use to be the most efficient possible, not only for us, but for our St. Clair County residents. We want it to run smoothly, because the more smoothly it runs, the quicker we can get through people.
And that's what we want, because, I mean, the staff, and now with the National Guard announcement, maybe that's gonna help relieve some of that stress, because it's been for 308 days, both the St. Clair County Health Department, East Side Health Department, I've been in contact with Liz Patton down there. They're coming up with their plan. The hospitals, as Chairman Kern said, every day, the coalition that has come together with the hospitals and the support that they're offering is next to none, and we need all of that.
And I know we've said it before, and I think sometimes people think that we just reiterate it, but it is truly a team effort from the hospitals to the health department, to EMA, to East Side Health Department, and a lot of other supporting agencies. One institution or one facility cannot do it alone. If we weren't working together, we would all be in a much worse spot, I think, farther back from the starting point from where we want to be. And, it just helps everybody move forward when you work together.
Well, and I think, as I say quite frequently, 2 more deaths today since yesterday, 371 in our county. As I sit here today, I can tell you that if that coalition hadn't come together with the hospitals, with our first responders, with the medical community, and with the help of Team St. Clair and all of you who have been part of the solution, those numbers would have been a lot higher than what they are now. Yes, 371 is, as I say all the time, 1 death is too many. The state of Illinois, 8,049 deaths to this deadly virus. I've got a few friends right now that are in the hospital with this virus. I've got 12 people that I was associated with that have passed away, and I'm sure all of you have stories like that. But we are making progress, even though some of you feel like we aren't. Believe me, as Sam said, everybody is working together. Nobody is sitting around with idle time.
No. And one thing I would like to point out, I know we had several questions at the health department about this today, and I'm sure you guys may have fielded some of these calls as well. There was a lot on the news yesterday about St. Clair County Illinois moving into phase 1B next week. So I can tell you we are not quite there yet. Our priority is still to finish 1A, which is our hospital healthcare workers and any other healthcare workers we have, doctors' offices that have medical staff. So we are not there yet. So please don't think that because you fall into that 1B category and you haven't been contacted yet that we forgot about you. We certainly did not. We are just not at the point of moving towards 1B yet. Our focus is still finishing 1A, which is all of our medical providers.
Well, as you and Chairman Kern talked the other day, we have a lot of those 1A
We do.
citizens, because we have the more hospitals in our area.
We do.
And we have a lot of those facilities, the doctor's offices and the dentist offices. So that's why it's taking longer than maybe a rural county that don't have all of those citizens that they have to do. But nobody is going to be forgotten, I can tell you.
No.
So, we say it each and every day, 308 days that we've all been in this together. We are stressed, but I'm telling you, the light at the end of the tunnel, somebody said the other day, they can see it. It's just a little bit longer tunnel. But the vaccine is on the way. The lady here to my right, Sam, is the vaccine lady. Believe me, she thinks about how much we're going to get, and she fills out those reports, and we're waiting, and we're going to be ready. And you'll be getting those calls, and we'll get that. Get your sleeve up, and you'll get that shot, and we can get back to some normal. We'll be back in a few moments to have this translated into our Spanish communities, and then we'll be back tomorrow for day 309. Everybody have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently. However, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.